My name's Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. Before that, I was a fly fishing guide in Patagonia, Chile, and southwestern Alaska for a decade. This is a clip from our online dry needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health. This is a great class. Check it out on our website, intricateartseminars.com, to get the full 10 CEU fully online class. Electrical auricular vagus nerve stimulation to improve pelvic health. This is one of my very favorite topics, you guys. It's so cool. So I was so disgruntled when I learned that the vagus nerve innervated the ear, because we were never taught this at St. Augustine when I went to school there. I've only spoken to maybe 1 or 2 people that say they've learned this in school, and it's one of the most important aspects of being able to help improve somebody's autonomic nervous system homeostasis, which is the key to being able to help improve somebody's health. So this first picture here is a good drawing of the general nerve distribution in the ear. There's been some good meta-analyses done, you guys, looking at, like, I think one of them was done with 250 cadavers. They were looking at the auricular branch of the vagus nerve in the ear. So most of the drawings are similar to this. Some don't have the lesser occipital nerve in there, but regardless, everybody's a little bit different. So this is in general where it is. So the green section in the center of the ear there, more or less, is the auricular branch of the vagus nerve. So that's the area that I target. The upper pink branch is the auricular temporal nerve. That's another cranial nerve. The bottom blue part is the greater auricular nerve. And then in this diagram, they have the lesser occipital nerve in there too. Some diagrams don't have the lesser occipital nerve in there also, but that's the generalized ear innervation. And the reason that I needle the ear as my first needles on 100% of my patients is because it's the most parasympathetic dominant needle that we can insert in the body as far as we understand with our current understanding of neurophysiology, and the vagus nerve being the primary nerve of the parasympathetic autonomic nervous system. Remember, chronic sympathetic autonomic nervous system hyperactivity is the primary underlying driving cause of the vast majority of chronic idiopathic autoimmune impairments, or just general chronic impairments that people have, you guys. If that is the case, which is true, one of the primary goals, or the primary goal of treatment, should be to depress sympathetic hyperactivity as much as we can, which elevates parasympathetic activity. Remember, it's like a seesaw, you guys. So the ANS, as far as we understand right now, at least, both the parasympathetics and sympathetics can't go up and down at the same time, as far as we understand. Totally may be wrong, but that's as far as we understand right now. It's like a seesaw. So if the sympathetics are up here, the parasympathetics are going to be depressed. There's 2 ways to get the seesaw more level in general. If you're starting in this position, you can depress the sympathetics, which elevates the parasympathetics reciprocally, or you can elevate the parasympathetics, which depresses the sympathetics reciprocally, right? Or you can do both at the same time, which is what I do with my needles, and you can just get a faster, bigger autonomic homeostatic response, and it just leads to better patient outcomes. So like we've mentioned, the most parasympathetic dominant portions of the spinal column are up in the upper cervical spine and down in the sacral plexus, S2 to S4. Because S2 to S4 innervates all 9 of the pelvic floor muscles to some degree or other, some combination of those nerves. And again, the obturator internus is the only one with some outside innervation from the lumbar spine. Because that's the case, because those muscles are so parasympathetic, we want to stimulate the parasympathetic nervous system all over the body, not just in the pelvic floor. And that's just not how the nervous system works, right? The parasympathetics and the sympathetics can be more on in certain places in the body, but they have a generalized, widespread, systematic effect on the body. So needling the pelvic floor stimulates the parasympathetics and depresses the sympathetics. But needling the vagus nerve, as far as our neurophysiologic understanding goes, that's an even more powerful way to stimulate the parasympathetics, which depresses the sympathetics because the ear is innervated by the auricular branch of the vagus nerve. And as far as we understand, that is the most parasympathetic dominant structure in the human body. There's been a couple of recent meta-analyses looking at this, you guys, and some of them estimate that 75% of all parasympathetic fibers outside the brain are within the vagus nerve itself, right? So that's a crazy, crazy discrepancy. My cat just walked up here. Come here, Migos. Come here, Migos. She's not going to pay attention. Come here. Oh. You guys want to see my kitty? Oh, this is my kitty. She's very nice. Her name's Amigo. Amigos, what do you think? You want to help me do the thing? What do you think? Huh? Want down? She keeps me company. She's my little buddy. One of the other things that I really think about a lot, you guys, is I try to think about human medical stuff in terms of like evolutionary thinking, because it's very, very important to think that way. And I think it helps give us a better like generalized understanding of some overall concepts. So one of the things that I think about, and I think this is for sure true, is that if you look at the life expectancy stats, you guys, in 1900s, the average life expectancy was like 50 years old. So humans, up until 1900 or so, for the hundreds of thousands of years that human type things are longer that have been around, our bodies were only accustomed to living to 50 years old. The main thing that changed our life expectancy has nothing to do with mainstream medicine, you guys. The main thing that changed life expectancy was just the realization that germs existed, which was pushed back against forever. And I believe the guy that discovered this ended up committing suicide because people wouldn't believe him, but obviously true. So when we accepted that germs existed, most diseases and the life expectancy went up, most diseases went away, right? So that was like one of the primary things that extended lifespan, was just the realization that like throwing shit in the streets and stuff was not conducive to good health. And once we started like washing and keeping things cleaner, a huge percentage of all that stuff went away and we started living longer. Go figure, right? And one of the other ones was improvement in childbirth, or less infant mortality during the birth process. Obviously, when little kids die, that really drastically pushes the life expectancy down. So those two things are the primary things that extended lifespan, you guys. And that only happened in like not that long ago. So humans have only had practice living over 50 years on average for a little over 100 years. So just a tiny blip of time in the whole span that humans have been around. I think that's one of the primary underlying reasons why so many seeming so-called diagnosed idiopathic impairments, and there's hardly any actual idiopathic impairments. It's just that when you treat everything with a pill that treats a symptom, or potentially with surgery, that neither of those are meant to actually, like surgery, I guess, but like the pharmaceutical stuff, not meant to actually fix anything. Tons of things are labeled idiopathic, but that's not the case, you guys. It's just, it's a chronic aggravation to the nervous system. And once people get to about mid-age, our body's just not accustomed to dealing with this increased stress that our bodies are under in modern society, primarily from things like eating food, stress levels, not being outside, not having enough vitamins and minerals in your body. Simple things to fix, but those are the primary underlying reasons that people's sympathetic nervous system just keeps going up and up and up as we get older, typically. And somewhere around mid-age, it just hits a breaking point where we hit actual energy deficiency, where the body has been in sympathetic hyperactivity for so long, the parasympathetics have been depressed for so long, the mitochondria are all hypoxic, they've run out of oxygen to produce ATPs. All of our ATPs start producing about 18 times less energy per glucose molecule process. We go into energy deficiency, which is one of the 12 hallmarks of aging, mitochondrial dysfunction, telomere shortening, body-wide inflammation. All these are of the 12 hallmarks of aging, including genomic instability, which energy deficiency causes because our DNA starts to get expressed abnormally and our body starts to produce things like too many pro-inflammatory proteins like the interleukins, tumor necrosis factor alpha, all that stuff. All that is to say that the singular best way that we have to counter that chronic sympathetic hyperactivity nastiness, if you had to choose just one thing to do to the body and use one needle, it would be poking the vagus nerve in the ear, because that's the place that we can treat the vagus nerve itself safely, and it has a massively profound positive effect on the brain and body. And there's tons of new literature that's been done on this, you guys, since 2020. Really, there's been an explosion of vagus nerve literature. So in this PowerPoint, we're going to go over a handful of brand new studies. I've taken the most important points out of the studies and we're going to go over. And there's references for all this stuff in here, you guys. The full-length articles are in here in Teachable as well. Thanks for watching, you guys. If you like this clip, keep an eye on my channel. I'm going to keep putting clips from both of our online dry needling classes. This was a clip from our online dry needling 2 class, Dry Needling to Improve Men's and Women's Pelvic Health. Check it out on our website, intricateartseminars.com, or check out our school channel, school.com/CEU, SKOOL.com/CEU, to get a big discount on our dry needling bundle. It's a bundle of both of our online dry needling classes for a big discount.